I know you think that bleeding gums are the only sign of gum disease, but there are actually 7 early warning signs most people ignore until it's too late. And if you catch this early enough, you can prevent it from getting worse. But if you miss these warning signs, you could be facing major problems down the road. So today, I'm going to share with you 7 early warning signs of gingivitis that you should not ignore. The first symptom is slight bleeding after brushing. Let's be honest, we all brush hard. Now, over time, this can cause irritation to your gums and lead to some light bleeding. In fact, one study found that about 63% of adults were unknowingly damaging their gums while brushing. Unfortunately, by the time most people realize what they're doing, it's often too late and they've already caused gum damage, leading to symptoms like bleeding gums. Now, yes, there are other causes of bleeding gums besides just brushing too hard, such as vitamin deficiencies, certain medications, and even pregnancy. However, if you notice that your gums start to bleed frequently after brushing and it doesn't stop, then chances are you may have an early sign of gingivitis. Now, this next sign is itchy or tingling in your gums. When you think of an itch or a tingling in your gums, do you reach for the floss? Well, if you experience an itchy or tingling sensation between your teeth and gums, it could be a sign that plaque has built up under the gum line, and when left untreated, this can develop into something much more serious. Plaque buildup can irritate your gums and lead to inflammation, which can cause a tingling or itchy feeling. The American Academy of Periodontology recommends flossing daily to remove plaque from between your teeth, which brushes can't reach. So, if you notice any itchiness or tingling, make sure to floss once a day to reduce plaque and prevent gingivitis. Moving on to number 3, which is your gums turn from pink to red. Healthy gums should be pink in color. If they begin to turn red, swollen, and puffy, this could be a sign of gingivitis. This happens when plaque irritates your gums and causes them to become inflamed. So if you notice that your gums are starting to turn red, especially in combination with bleeding, it could be a sign that it's time to see your dentist and find out what's causing the problem. Next up is number 4, and that is when your teeth appear longer. Are your teeth looking a little long in the mirror? If so, it could be a sign that your gums are receding. Gum recession occurs when the gums pull away from the teeth, exposing more of the tooth than usual. And one of the main causes of this is gum disease. Plaque buildup can cause your gums to recede, which can expose the roots of your teeth. If left untreated, this can lead to more serious problems down the road. So, if you notice that your teeth look longer or more exposed, it's important to see your dentist right away to find out what's going on and get treatment as soon as possible. Another sign is when your gums are sore to the touch. If you've brushed too hard or flossed aggressively, your gums may be sore for a few hours afterwards. But if your gums are constantly sore or feel tender to the touch, it could be a sign of something more serious. If your gums are red, swollen, and sore, it could mean that you have gingivitis. To prevent this, make sure to brush gently and use a soft, bristle toothbrush. You should also avoid using abrasive toothpaste or mouthwashes, as they can cause irritation and make the problem worse. On the other hand, if you're experiencing constant pain in your gums without any irritation or swelling, it could be a sign of something else entirely. This type of pain is often described as a dull, aching feeling and may be accompanied by fever, fatigue, or swollen lymph nodes. If you experience this type of pain, it's important to see your dentist right away, as it could be a sign of a more serious infection. Now, moving on to the next symptom, which is flossing becomes painful. Now, flossing is an essential part of good oral hygiene, but if it starts to hurt, it could be a sign that there's something wrong. If your gums are inflamed or there's plaque buildup between your teeth, flossing can become very painful. In fact, one study found that 28% of participants experienced pain when trying to floss between their teeth. This pain can be caused by a number of factors, including sensitive teeth and gums, improper flossing technique, or plaque and tartar buildup. If you're experiencing pain while flossing, It's important to take a closer look at your oral hygiene routine and make sure you're brushing and flossing properly. You may also want to try using a different type of floss, such as waxed or flavored floss, which can make it easier to slide between your teeth. If the pain persists, it's best to see your dentist and get professional help. Last, but certainly not least, we have a bad taste or dryness in the morning. If you wake up with a bad taste or dryness in your mouth, it could be a sign of gum disease. This happens because plaque buildup can cause an overgrowth of bacteria in your mouth. This bacteria produces toxins that cause bad breath and a dry mouth. And here's where things can become a bit tricky. A dry mouth can also be a side effect of many medications, such as antidepressants, antihistamines, and diuretics. So, before you blame gum disease, it's important to talk to your dentist and doctor to rule out any other potential causes. To help prevent a dry mouth, you can try drinking plenty of water throughout the day, chewing sugarless gum, and using a humidifier. But if none of these tips work, it's important to seek a professional help, as a dry mouth can be a sign of something more serious. So, let me ask you a question. Can you feel it? Before it becomes irreversible, gingivitis may start with just a slight bleeding after brushing or an itchy feeling in between your teeth and gums. But if left untreated, it can quickly escalate to red, swollen gums teeth that look longer than usual. Gums that are sore to the touch pain while flossing or waking up with a bad taste or dryness in your mouth. Once gum disease progresses to its later stages, the damage can become irreversible, resulting in tooth loss and even more serious health problems. That's why it's so important to be aware of the early warning signs of gingivitis and take action as soon as possible. Think about it like this. The smallest leaks sink the largest ships. Gingivitis begins in whispers but can end in a shout. Don't wait for it to become a roar. Catch it early or treat it for life. Remember, gingivitis is preventable and treatable. With good oral hygiene and regular dental checkups, you can keep your smile healthy and bright for years to come. But if you ignore the warning signs, it can escalate quickly and lead to more serious problems down the road. So don't wait until it's too late. Take action today and protect your smile. Now, since you made it this far, I've got a bonus tip for you. To reduce your risk of developing gingivitis, consider using an antimicrobial mouth rinse in addition to your regular oral hygiene routine. These rinses contain ingredients that kill bacteria and reduce inflammation in the mouth, and the American Dental Association recognizes them as an effective way to prevent gum disease. Just make sure to choose a mouth rinse that's right for you and follow the instructions carefully. Using a mouth rinse along with brushing, flossing, and regular dental checkups can help you maintain good oral health and keep your smile looking its best. Hey, thanks for tuning in. Hope you enjoyed the video. Check back soon for more tips on how to improve your dental health. See you next time.